So today we have another discussion, another topic, and another patient, Christina, who went through therapy. It's still in therapy, and the focus of our topic today will be breast implants and any type of implants and Lyme disease or tick-borne illnesses, as well as the impact of breast explantation on the disease. And so let's talk about, again, our traditional question is how many years ago you were absolutely healthy and what happened?
Absolutely healthy was before, I don't know, maybe spring of 2016. So everything...
So we're talking about 2 years ago.
About 2 years ago.
2 years ago.
So everything, all the symptoms or things started to happen in fall of, if not earlier and I didn't realize it, but really significant symptoms started in 2016.
So what exactly happened? Do you remember? Like you were bitten by a tick or you were not bitten by a tick? So what exactly happened?
My neck just started hurting. So I started having severe neck pain, shooting down my arm, back, all the way down, and then end up down to my extremities. So down my legs with numbing and tingling, palsy type symptoms in my right cheek. Progressively got worse, saw orthopedist after orthopedist, and that ended up in my primary doctor's office saying, well, they found bone spurs in my neck, but it was nothing that they needed to surgically repair, and said to keep looking. And they did an injection, which I wasn't happy and didn't want to do that. And I knew it was a Band-Aid, but then I started going down brain fog, couldn't focus, couldn't recover, I was exhausted. And then the symptoms just kept going from there, if you want me to go through that.
Yeah, absolutely.
So, brain fog. Over time, the pain not only was in my neck, and we started treating it. So I was taking Neurontin, which is a nerve medicine, which was making it even worse. I was taking pain meds at the time, nothing was happening. But then it started progressively going down my spine, which ended me in taking heavy pain meds like Norco up until August, which is a couple months ago. Joint muscle pain, sleep deprivation was awful. I knew that it was also muscular. I think what was happening is my body was trying to help support and fight. So my muscles were binding, in a sense, trying to protect or overprotect what my core could not do anymore, because I couldn't sit or stand for more than 10-15 minutes, or the pain, I felt like my body was going to crumble. I went from healthy to really, really sick. And
then we decided to treat you very aggressively, right?
Yes.
So we started you on our own kind of home-based protocol where we treated you with IV double antibiotics, and presumably Lyme disease was pushed into dormant state, but you were still not doing well.
Right.
You were still having symptoms.
Yeah.
And then you brought up, not me, but you brought up an issue about your breast implants, right?
Last January.
Well, so how did you come up with the issue about breast implants? So what prompted you to talk about that?
So as my health was declining and we were treating and I continued to get worse, I had heard stories of friends that had that had the similarities and their bodies were rejecting them. It's very confusing. These blood tests are blood tests. They're supposedly accurate. It's all you have to go off of, and you treat what a blood test shows. The whole situation is very confusing. What I knew about health and everything was going out the door. So I heard about that, brought it up to see if it was something that we should explore. We wanted to wait as we were going through the protocol, because it is drastic. Surgery is hard on the body, especially when as sick as I was. Wanted to make sure that was going to be hopefully the last straw.
And how many years ago did you get your implants?
I got them in November of 2016. No, 14. Sorry, November of 2014.
So
everything
basically
started in 16.
the time frame between the implantation of the silicone in your body and development of the symptoms was around 2 years, right?
Yeah, a year and a half to 2 years
A
later.
year and a half, 2 years. All right, all right. So the reason why I didn't want to proceed with the breast implants right away, because again, we're dealing with that in our clinic routinely on a daily basis. So you were loaded with infections, right? And so the first step was to bring infection under control. But explantation was a necessary step, and I'm glad that you agreed and understood and actually brought it up. Because what happens is silicone implants and any other implants, not only silicone implants but other implants, they kind of absorb microbial toxins. And then your body, even though you're clear from infection or infection is dormant, your body is still fighting as if you were dealing with active infection, because all these toxins exposed on the surface.
Right.
And so, and the only way to bring the whole, inflammatory reaction down is to remove those implants.
Right.
And we do see it not only in patients who have silicone implant. In your case, it was not completely silicone, it was silicone shell but filled with normal saline.
Yes.
But it doesn't really matter because it's a silicone outside,
Right.
which creates a problem.
Right.
Surprisingly, we start seeing more and more patients with prosthetic joints who have exactly the same reaction, because let's say you have titanium knee prosthesis, and so titanium also absorbs a lot of toxins, and so you're reacting to it. So it's not reaction to titanium, it's reaction to the surface, covered with microbial toxins or other kind of necessary molecules. So, and around 2011, if I'm not mistaken, one of the Israeli rheumatologists, Dr. Schoenfeld, he put all these entities together, and so he described an entity called Asia syndrome. And actually he published a couple of books. One of them is Vaccines and Autoimmunity. And the second book, which is almost like a Bible for rheumatologists, is Infection and Autoimmunity, which he describes different infections in connection with different autoimmune diseases. And in the first book, which I showed, Vaccines and Autoimmunity, there are several chapters talking about silicone breast implants in connection with Asia syndrome. So basically, the whole idea is once you remove the silicone, you decrease the load of microbial toxins accumulating on the top of the implants, your body starts recovering. And that's what we notice in your case. So now I would like you to share your experience with your symptoms after explantation. So what have you noticed? What happened exactly?
So I had my explant July 5th of this year of 2018, and it was not just under a week later, I got really sick. My body, the way I look at it, it was trying to detox itself naturally. I couldn't keep anything in me. Everything was going right through. We also, during that time, found that I had a parasite, but that was just, I think, at the same time. So I think my body was just getting rid of that. By August 2nd, I took my last bite of heavy pain med, Norco, and wasn't reliant on the pain med anymore.
So you went cold turkey and you're fine.
Yes. So pain is
excellent.
still there. I still have joint pain. I still have muscle pain. I still have exhaustion, that sort of thing. But it is night and day from what I was experiencing before. So
basically you're much more functional than before, right?
Way more functional.
So if you look at yourself globally, and you know me, I like metrics. So how much better you are now compared to before the surgery, percentage-wise?
Yeah, so percentage-wise, I was probably operating barely around 10%, and then probably at 70,
so
75
60-70% improvement, right?
Yeah.
And even more, when we repeated your blood work, your antibodies to scleroderma started declining down.
Yes.
So, which we didn't see during the time when we treated you with antibiotics. So they were still kind of up. And although your Lyme test cleared up after antibiotics, you were still having symptoms, and the scleroderma antibodies were still up, right? But now everything is going down. Obviously, you're not in perfect shape, but you're on the recovery road.
Yes,
right?
I can see a light, where before I couldn't see a light.
So what kind of message you want to deliver to other people who are in your situation?
So,
because it's very important.
Okay.
The whole reason why we're doing these things is to educate patients and people who are dealing with the same condition.
yes. It's huge. It saved my life, there's no question. When I I also had my IUD as well as any metal removed from my mouth.
It's the same idea, so they absorb toxins.
Yeah,
Same,
and that was done
exactly
in
same
May
idea.
or April, May, and I was no longer reliant on Zofran to get through the day. I wasn't living in nausea.
So you stopped Norca, you stopped Zofran, which is huge.
Yeah, no, I was living on that daily since January. So for 8 months, I was reliant on that to get through the day. So my advice, and I wrote this out, sometimes easier for me to articulate because my brain's still not 100% back 100%. My message to those that are diagnosed or go from healthy to very unhealthy, it happens quite quickly. Be proactive in your body and symptoms. Everyone is different and our bodies react differently, but there is a part of me that wishes I did the explant surgery earlier on. It's all a mystery and a trial and error with treatments, but I am the living testimony to having our bodies cleaned of anything foreign is a means to a healthy body. When diagnosed with autoimmune disorders, our body is fighting a major battle, and when it has anything foreign inside, it has to fight that as well. Our bodies just aren't equipped to fight everything at once, and this is all coming from me, but I am one of many out there. I hear and read stories every day of women experiencing similar symptoms and diagnoses and worse. I really would like to help someone not get to the point that I did. I did not know if I was going to make it. There was many a times, and it's very emotional for me, that I was in the fetal position in my closet with lights off, hysterically crying because of the pain and nausea, and not knowing if I was going to make it, or I didn't want to at times. It was really unbearable. But I knew I needed to fight through it. I have myself to live for, as my family and friends. But
And you have an excellent support.
I've had an enormous support system that's helped me get through this. There is also a site that it's a closed group on Facebook that also talks about, there's over almost 55,000 women like me. But that's just those who know
huge,
about this. It's
huge.
humongous, and it's only me, and you have to be invited to the group. So I had a friend of mine say, I look and I see women that have breasts and I get upset because she knows she needs to get hers removed. But my response was, I used to look at women happy, laughing, walking, running, what I used to be doing, and that would get me upset. I just wanted my life back, and I know it will slowly happen now that I've done so.
If you don't mind, I want to ask a couple of private questions, if you're open for that.
Totally.
So, have you noticed any changes in your body image or perception of kind of self-esteem after explantation?
I'm happier in my body now.
So you don't regret it from cosmetic standpoint?
Not at all.
So next question is, what was your process in terms of decision making? How did you make a final decision? Yes, I want to do it. That's number one. So number two, how did you find a surgeon? Because a lot of women, they kind of lost there. A lot of plastic surgeons around, you know. So if you can share your experience.
Okay. Good questions. Back in January, when I started hearing these stories from friends of friends, and it was food for thought. And then I was also introduced to this page, all these other women. I was open, but yet maybe not more exploring the idea. Nervous, confused. This has all been really confusing, everything. Would this fix me? Is it going to be worth, not necessarily the fact of losing my breasts, or the fake ones, but the implants, but is that really going to make me better? It was, that was the biggest treatment, biggest test of all of them. It was a big surgery. Was it going to be worth it?
This is absolutely important to understand that, a decision like this faced by 1,000 women,
Yes.
And it's like a crossroad. Where do we go?
Where do you go?
And in this situation, my personal advice is, if you have an underlying illness, you need to treat it first to bring it under control. Because let's say you have active Lyme disease, so you have another tick-borne illnesses, and you do explantation while you're dealing with acute illness, it's a disaster.
Yeah.
So you need to bring it under control, and then you can do explantation. So what you've done was absolutely appropriate.
Mm-hmm. Right. And I knew, and there had more and more people or stories I would hear, anybody that did do the surgery got better. There was no one that went through it and it didn't help them. And not knowing, I do believe that it was them that brought out the resume of infections, diseases, whatever they are, out of my body. It was just that stressor that my body needed to bring everything else out. So,
And how did you find the right surgeon? So what was the process of finding the surgeon?
You recommended a surgeon. I reached out immediately, got a consultation appointment for a few months out, which felt like years. I had gone through another bad IV day, which were taking me upwards of 5 hours a day. I came home crying. I called that office to move it up and just beg, please get me in sooner. They moved it up a month. I was still a month out from seeing them. And I asked at the time, what is surgery even looking like? And she told me February of 2019. I couldn't go that long. I knew I was not going to make it that much longer. This is May. That was literally like, that was so far away.
Next year.
So yeah, it's next year. So I went to a local plastic surgeon, and he looked at me right away with my medical report and said, if you were a sister, I would tell you immediately to get them out. You were not well. So yes, it was a good experience. So whether he got the full explant and the capsulectomy didn't happen. So the full capsulectomy, he got a majority of it out, based on the thinness of my capsule and his fear of tearing my muscle and incurring more damage on my body. But the concern is, and the reason why you had recommended the specific doctor, there is a worry that there's still some toxins left in my body.
Because the capsule is poorly vascularized, and so it's almost like another, area attracting toxins. So, but again, it's not as large as the implant by itself, and there's another reason why we recommended to start detox therapy after to move whatever left in, move it out.
Yes.
And so hopefully it'll work well, and you're still in process of recovering. You're not basically
no, I'm not
100%
deteriorating.
right away,
No.
but you're not getting worse.
No.
So that's the bottom line.
Yes, absolutely.
Right.
There's more of this happening, and they're going to need to understand that. I mean,
so basically, everything is driven by demand, right? So if more and more women realize that various implants, and we're not only talking about breast implants, there are other implants, if more and more people realize that implants affect your life, so then it will be a grassroots movement, and so then people start looking for more physicians, and so then obviously more physicians will be available.